Good afternoon, Yvette, and everybody. Welcome to From Pills to Purpose podcast. How are
Good
things today?
afternoon. Very well, thank you. Super excited to be here and carry on with our questions that we most commonly get asked in our profession.
Yes, and one question that we get asked I won't say it's all the time, but most of the time is patient comes in, new prescription for metformin, obviously needs to get a consultation. And one of the questions, why would my doctor put me on metformin? So I think it's a good thing to start off with because metformin is one of the most common drugs commonly used for type 2 diabetes and also what is called insulin resistance or pre-diabetes. You had a good analogy about pre-diabetes and pre-pregnant.
I don't believe there's anything like pre-diabetes. There's a couple of studies that were done over a period of 13 years, and the graphs really indicate an increase in the insulin resistance. And literally the last 3 years, the blood sugar spiked up. So that person wasn't pre-diabetic. They were already diabetic, but the normal blood work and the labs that we take wasn't showing it. And yes, I always love to say you're not pre-pregnant. You're either pregnant or you're not.
True. But what is pre-diabetes or insulin resistance or whatever the doctor might call it? They're all, in my opinion, the same thing, fall under the same blanket. But how does it happen if I've been eating a healthy diet all the time?
Well, this is something that is so basic. And I love when you think about it. This is warm season, cold season. We like to have cookies and things. So let's say you eat a chocolate chip cookie. That chocolate chip cookie has a lot of carbohydrates in it. When you do ingest that and it gets into the stomach, that gets broken down to the molecules, which we all know as glucose. So what does the body do with that? Now, for a lot of people, you have to understand if you go over a certain amount, like 1 to 2 teaspoons of sugar in the blood, it's toxic. So our body is taught to regulate it. So the insulin is released. So this is where I love when people don't realize the other name for insulin is called the fat storage hormone. So the insulin then has to take these glucose molecules and go store them in the cells and in the muscle, opens the little doors, like so many of us understand. But there's a tipping point where that insulin gets to a point where it's not able to accommodate the amount of glucose molecules that's coming in, can't unlock the doors, and that's when we get to the term insulin resistance. Now, you will understand that in the food that we eat these days that are so heavily processed, very much carbohydrate loaded, that does become a problem. And for everybody, there's a different tipping point. And you might be 45 years old, you might be 70 years old. We don't know and we cannot say when that happens. But at a point, your body will then respond by, I can't store this anymore. And all of a sudden, these blood glucose levels just shoot up. So to understand that what you eat, how the body needs to metabolize it, store it in the cells, but there's a point when the body just says, I've had enough. I
So
think
in-
that's kind of a clear picture for people to see that.
Yeah, so in other words, way my brain understands it is there is a system to get rid of those blood sugar molecules, and the system basically gets overloaded, and then it just can't function the way it's supposed to anymore.
Right. It becomes toxic. We don't feel well. People gain a tremendous amount of weight. It gets to the point where the cells cannot accommodate that anymore. And like I said, insulin, the fat storage hormone, where does it go? It makes fat cells. It makes them bigger and bigger and bigger. So it really does become problematic. And at that point is when people will turn to the doctor and say, oh, something's wrong. Well, what do I do?
Yes. And what is the first thing that comes out is a prescription pad, and more often than not, a lovely prescription for metformin.
Metformin is, when you look at the medical, let's say, work instruction or the SOP that they follow, that is the first line of treatment. Why it is, I don't know, but that is what it is.
I want to say also, if you look at many drugs that is used for type 2 diabetes, even though metformin has a whole string of side effects, but so does any drug you take, for whatever reason, it still has side effects. If you look at what the other drugs do, the way they work in order to get your blood sugar down, metformin is probably not as bad, but it can make you feel absolutely horrible. And we had a little discussion earlier, you have to think about, we always talk as pharmacists as mechanism of action. And if you do look at the mechanism of action of a drug, there are certain things that is clear cut. And all these things that we described as side effects, I want to say is actually unwanted effects of the same mechanism, because this mechanism is going to work in your body the exact same way it does to mine. I might feel horrible, but you might not feel horrible immediately,
Mhm.
because to some lesser extent, these unwanted effects still happen in your body. And Yvette, what is one of the biggest ones that happen what makes people stop this medicine?
The most debilitating thing is the absolute horrible explosive diarrhea. People honestly tell me I cannot leave my house. I'm too scared to go out. Everywhere I go, I need to know where there's a toilet. It becomes such a focus in their life that they can't live. And I agree with you. Of all the ones, let's say it's the lesser of all the evils, but it does come with a huge amount of adverse effects, side effects, whatever you want to call it. For me, when you have to live a life like that, it really is not something that's going to be helpful, because I honestly wouldn't like to be worried the whole time. Do I need a bathroom? Is there going to be an accident? Because it's very embarrassing. And I find that, especially for a lot of the elderly patients, it becomes worse and worse. It does not get any better.
Yes. And if you look at the mechanism of action, because we were always told that the number one way that metformin works is it helps a glucose transporter in the cell to help the glucose get out of the blood into the cell. And yes, that is true. That is something that does happen. But there are some other ways that it also works. It also works in a way where what was the word?
Suppresses the
Yes,
gluconeogenesis.
suppresses gluconeogenesis, the way your liver makes the glucose on its own, because your liver makes glucose on its own. If it needs some, it takes some protein and it makes it. Not as effective making it from fat, but it can make it from protein. It also decreases the absorption of glucose in your gut. Now, here is another question. We have this little lovely bottle of syrup that we sell in the pharmacy most often on prescription, called lactulose. Now, what do we use lactulose for?
It's for the people that are so constipated that they cannot poop.
Now, is lactulose a sugar? So if we
And
stop sugar absorption in your gut, it's going to,
that's when you cause the opposite.
yeah, it is going to pull water into your colon, and you might have to stay close to the bathroom.
It's so interesting when you compare those two, because the one is inhibiting the sugars, letting them get sent straight through to the kidneys. The other one is causing more sugar in the blood, in the GI tract, and that causes you to have a gastric release. And it's quite interesting that I've never thought about that, but that's a very good correlation.
Yeah. And one other thing that we discovered is that metformin also, in a way, we don't have to give you a biochemistry class, but it upregulates a neurotransmitter called acetylcholine. And one other thing that is a very common side effect is stomach ache, abdominal pain. And if you think about, when do you have abdominal pain? Sometimes you would also describe it as cramping.
Hmm.
It will hurt. Now, acetylcholine is very responsible for muscle tone and muscle contraction. And your GI tract is a thin lining of muscle. It's not just a little tube to absorb nutrients from what you've eaten. It also has a muscle in order to cause peristalsis, to move what you ate through your body the other way out.
Yeah.
And if the acetylcholine increases, what else increases? The peristalsis that moves the things along. And
So
now,
that's why a lot of the acetylcholine products have always been a warning on there that it can cause diarrhea, severe cramps. So when you take the metformin and it upregulates that, and you have more of that present, so that means you're going to have more of the very watery stools, uncontrollable bowel movements, because the peristalsis is constantly working and pushing it all out. And also, on the other hand, too, is with all of that, you lose a lot of nutrients.
yes, because the shorter the time for what they call bolus, what you've eaten in your GI tract, the less of the time there is for absorption, because not everything gets absorbed in the exact same space in your small intestine. Certain things gets absorbed in the top part, and certain things get
in the
absorbed in the
lower.
bottom part. So
Yeah, and
if it
that's
moves too
so
fast,
you can't pick which one it's going to miss.
no,
And you see with this people taking it now, it varies. And you and I spoke about that. One of the things is the vitamin B12, that's cyanocobalamin. And you'll find that some patients will immediately, when they start it, they have a massive shortage of vitamin B. And for others, it develops over time, but it will develop
yes,
because it's blocking that pathway. And again, then you sit with things like anemia could develop, very tired. There's so many things that go with that. And it's good for people to know that, because you do get the patients, and we know those, Johan, they want the medication. They
yeah.
don't want anything else. They want the medication. But it's usually the ones that ask us, why is the doctor prescribing metformin? Those are the people that are a little bit more inquisitive to find out, but isn't there something else?
Yes. And my opinion, and the way we were trained as pharmacists in South Africa was you have to explore the other ways first before you just throw a tablet at them.
True.
And I feel, and it can be because of the overwhelming, that the medical system is overwhelmed. A doctor only have a few minutes to see you before the next patient walks in. And it's the easy fix instead of sitting down with you and explore the other ways that you can make these changes. Unfortunately, the other way that is probably more effective in bringing the blood sugar down. And also, if you think about your lifespan and your health span, that will benefit you the most is lifestyle change.
And I want to just tack on to that with what you said about the doctors. I was on the phone yesterday with a pediatrician, and gentleman, so fantastic, 77-year-old pediatrician. And he said his entire life he's wanted to help patients, but the medical system has gotten to a point where the paperwork, the obligatory codes, the numbers, the stats, the questions, the have you done this, have you done that, has taken so much away personal time that he can spend with a patient. So the guy that he looks at and goes, oh, you have a foot fungus, let's do something, versus somebody like, for example, this with more of a metabolic thing, because believe it or not, the pediatricians are seeing far more type 2 diabetics than ever before. So he cannot spend that time. So I do truly, my heart breaks for the fact that the ones that really want to help, there's such restriction and there's no other time. So what you were saying, the massive amount of people you're dealing with, it becomes to the point where, okay, here's the prescription.
Yeah.
But you and I still feel a responsibility, because we also became pharmacists because we wanted to help people.
Yeah.
First, do no harm. First, help. First, treat in any other way, shape, or form before drugs. And I've often, it's hard when you have that question, why did they give me the metformin? And I typically have a counter question. Did the doctor tell you to change anything in your diet? Not your lifestyle, your diet, because many people at that point already have this guilt complex. I don't work out enough. It's not your working out. It's not your exercise. It's not that. And this is something Johan and I will say over and over again. You cannot out exercise a bad diet.
100%. And talking of that, I know someone who loves his exercise bike, and he will spend 2 hours a day on that exercise bike. And guess what? His blood sugar is not budging.
Yes.
It's still the exact same as it was. Still insulin resistant, where the doctor tells him, oh, and by the way, his A1C is 6.4. And the doctor said, oh, you're just insulin resistant. To me, that's diabetic range. I would not just call that insulin resistant. But
No.
his sugars is not changing, and he's doing 2 hours a day on an exercise bike. That's a lot. And I don't recommend that for anybody, especially if you're older than 40, because the amount of inflammation that will increase by doing that amount of cardio will be worse for you.
Yes.
The two evil twins is oxidation and inflammation. And 2 hours of a day, especially
Mm-hmm.
once every other week, may be okay. But every day, oh no, you're headed for a disaster.
And part of the adverse effects, what you were talking about with the diarrhea, the flushing out, more absorbing everything. One of the nutrients that is always very much depleted for diabetics is your salts, your potassium and magnesium, your sodium, and with metformin, more so the magnesium. And then we have situations where people become depressed. Obviously, you don't have the B12, you're becoming anemic, you're feeling tired, you have diarrhea. So what you were saying earlier on is you might not even know it's this causing it. But these are the little building blocks that are slowly but surely, you get so used to the new normal that you don't realize this is not how you're supposed to be feeling.
True. And, just let's take a scenario. So I've been taking metformin now for the past year.
Uh-huh.
And I come and say, I'm very tired. And the doctor obviously says, let's do a full blood work for you. So a full blood panel gets drawn and say, oh, you're very deficient in B12 and magnesium. What is a doctor inclined to do next? Is he going to stop the metformin or
Supplement.
supplement?
And that doesn't happen very often, I must say, as well.
Yeah.
Because a lot of them are of the train of thought that the supplements really don't help. But in a case like this patient does need it.
Yes, for sure. Especially if somebody is on metformin, B12, and I never really recommend B12 as a single supplement.
Mm-hmm.
If you do need a higher dose of B12, take a B complex with it. Just otherwise, you will create a deficiency elsewhere because one single entity of a vitamin family will cause a deficiency in another area. So rather take it with your B12, but not on its own.
Yeah, I'm so glad you said that because that's such an important component when you do look at the B complexes, what the B1, B3, B5, B9, B6, B12, then you got inositol, you got choline. So if those components are out of whack, then you're going to cause more trouble if you just only take the B12. So just like Johan said, I cannot emphasize that strong enough. Take a vitamin B complex. Make sure you take it. And then you can take the B12 on top of that to give additional. But if you don't have that balance, you're going to upset a scale on the other side.
Yes. And now you actually mentioned something that the choline is a B vitamin too. And we have had this discussion. What does metformin upregulate?
Acetylcholine.
Acetylcholine. So where does
Mm-hmm.
that choline come from? It comes from the ones that you already have. So there's a good chance that the metformin might cause a slight deficiency in choline as well. So
Mm-hmm.
don't just take the B12, get the B complex with choline in as well, because you do want to supplement the whole family of vitamins. Otherwise, you will just create a deficiency elsewhere.
And then the choline is very, very good for mental clarity, cognitive, all that kind of stuff. So it does all interlink and play a big role. But if you and I now have a person there that's brand new with metformin and you ask them, did the doctor tell you to change anything in your diet? And they said no. Then what would be your first response? And this is something we have to understand, we have to be inclined to our heart to hear that that person is asking us for more than just a drug.
Yes. I actually had this discussion with now a long time GLP-1 user, and doctor is so impressed. His A1C is down to 6.5, and I'm impressed. And I told him, you can get off of this if you change your diet. He says, yes, but he does everything that the dietitian tells him to. And I said, okay, well, let's hear. And usually when I have this discussion with people, even if they haven't seen the dietitian yet, I will ask him, what are you eating? What do you eat? What is the things that you usually eat on any given day? And if you listen to the amount of, now, obviously, when you talk to your pharmacist, you're going to tell them all the healthy things that you're eating. And those healthy things many times include bread. Why would you eat bread if you're a
But
diabetic?
Johan, it's healthy bread. It's Ezekiel bread.
I had also one person said, I only eat organic potatoes. You're a diabetic. You should not eat potatoes at all.
I eat brown rice. I don't eat white rice.
Same thing. And brown rice, most brown rice is not the rice with the husks and the hole in it. They're just white rice dyed brown so that you can think, oh, now it's healthy. It really is not. all those starches from rice, potatoes, bread, you name a starch, even though you might think it is healthy, it is because it's not sugar. I don't eat that much candy. Candy is probably the least of your problems.
Well, the one that I love is I don't really eat sugar. And my
Yes.
question then is, are you talking about the white stuff that you put in your coffee? That well, I'm not talking about that.
Yeah.
And that is kind of a hang on. I'm talking about the glucose molecule.
Yes. And what is a starch? Different starches go by different names, but the moment it hits your tongue, there is this little known enzyme that even starts in your mouth called amylase, and it starts breaking down that starches into smaller sections. By the time it hits your small intestine, it's basically glucose
Mm-hmm.
because they all get broken down. The starch is just a long molecule of sugar that does not taste sweet because it's such a long, extended molecule. Now, if you break it down in shorter pieces, you eventually get to the building blocks.
Glucose. It's funny what you say because I love it when people say, I eat a very healthy diet.
Yes.
I have my cup of oatmeal every morning. And if you know me for any longer than 5 seconds, you will know that oatmeal is horse food. It's not human food. And then in about 2 or 3 hours, I have a cup of yogurt with some fruit in there. And I only drizzle some honey in there because the doctor said honey is okay. And at lunchtime, I have a very nice chicken sandwich, but I eat brown bread or easy cube. And in the afternoon for my snack, I will do like a hummus with a nice little pita bread, but it's organic pita bread. And then for dinner, I'm really good. I only have a couple of potatoes and then I'll have some salmon. And I'm sitting there going, no wonder you're always hungry and no wonder you are so underfed. Because
This,
that is a classic example of what the world, the medical world, the marketing, everything out there is a healthy day.
Yvette, this sounds so familiar. I've heard that diet so many times in various variations because people like different things. But if you look at the amount of, and they will tell you, they will justify it because there's fiber in it. And frankly, I think the people have been so brainwashed about what a healthy diet really is.
Mm-hmm.
Paid for by people who make a lot more money than you and me to advertise about why certain things that me and you consider as completely garbage is a health food.
That's why when somebody says I eat a healthy diet, I always my next saying is try me.
Yeah.
Tell me what you eat. Because eating a healthy diet does not tell me anything. It means you either follow what the marketing and what the pharmaceutical industry and everybody tells you so you can stay sick, or maybe, just maybe, you know what you're talking about.
Yeah. And that brings me almost to the point. I don't want to go down too many rabbit holes here, but it brings me to the point where people say, but when we tell them, okay, you've got to cut out this, you've got to cut out that, and we tell them, okay, after you eliminated all these carbohydrates, now maybe your blood sugar will come down. Then the next question is, but I think you should eat a balanced diet. Balanced to what? Now that we got rid of the overweight of garbage that caused your insulin resistance or diabetes in the first place, now it is close to being balanced. And we haven't even talked about the leafy greens that cause you oxalate dumping.
Exactly.
We're not even there yet.
But it's also quite funny when you were saying, I thought you were leading on to that, where when you tell a person you've got to cut back on the carbohydrates, one of their most common questions is, then what am I going to eat?
Yes.
And I'm thinking, there's a world full of food out there. First of all, with the food you are eating, you're not getting remotely enough protein, which
Yeah.
is a building block, which you cannot live without. You're not getting any of your healthy fats because you've been told to cut the fat, cut the sugar, cut the salt, all the stuff that your body needs. So it's always so funny when people go, but what am I going to eat?
Yeah.
Well, first of all, you're going to throw the box food out.
Please, those box foods are probably the most poisonous thing you can have in your house, especially if you think about if you have young children and you give them cereal for breakfast. If there's a new parent, please don't ever do this. I
Mm-hmm.
know when kids start eating There are these baby cereals to move them from milk to solid foods. There are other ways. The other ways to prevent them from being a carbohydrate addict before they're 1 year old.
And we get warned about or scared about giving kids something like an egg and things like that for so many years. And yet that's probably one of the safest, easiest things to give to them. They tolerate it well. It's easy as a hand food. But we sidetrack there because we want to make sure these parents don't develop their children into type 2 diabetic. So if you as a parent set an example and your kids follow it, that'll be better.
And Yvette, you mentioned something earlier about the age. Now, I remember growing up when actually 25, 26 years ago, when I just started in the pharmacy as a pharmacy intern in South Africa, our diabetic patients were old. Well,
Mm-hmm.
now I'm almost that age, but
Yeah, but they were, John, they were in the late 40s and 50s. They were older
yes,
patients.
they were really much older patients. I mean, I
Yeah.
remember our worst diabetic patient that came in was about, I think, almost 65, 70 years old.
Mm-hmm.
And we did not see that many. Now, today, it's almost like everybody needs to take diabetic medicine because that is one of the most frequently prescribed, that and statins, so two most frequently prescribed medicines in our pharmacy.
Well, I had a metformin solution being prescribed to a 9-year-old.
Man,
So
shocking.
yes, the age is dropping, and it's not that the genetics, what we give to our children, what they inherit, it's our habits, it's our lifestyle, it's how we eat, it's how we think we eat healthy, and we're passing it on. And again, the statement comes up. They don't know what they don't know.
Yeah,
And until they meet somebody like you and me that says, hang on, you don't have to live like this. And also the thought that this is a death sentence, Johan. I've diagnosed you with this can never be cured. That is an absolute complete lie.
absolute lie. I
We've
agree.
helped people. I've helped people who were full-blown diabetics with A1Cs of 7.8 and 8.2, living completely normal lives, no medication, nothing. So I do want to make that statement. If you feel like this is, my gosh, this is now forever, no, it's not.
Yeah, that is definitely not a death sentence. Type 2 diabetes, especially, is something that can be 100% reversed. Type 1, where you were born with an inability to make enough insulin, it can be improved, probably not completely reversed, that you're never going to say that you ever had diabetes or anything again. But type 2, which I don't want to play a blame game and tell people it's all their fault, but
Mm-hmm.
in a way it is self-inflicted. But it is not, I want to say it's self-inflicted because of your own doing. I want to say it's self-inflicted because of what we've been taught.
Yes. And I feel that's a very responsible thing for us to do because so many people feel such a lot of guilt because most of your type 2 diabetics, not all of them, but majority of them are overweight. So they're already having this massive battle with, okay, I'm overweight. So I probably must be like eating at nighttime or eating my sleep. But it's the whole mechanism that's fallen apart. So you are in a fat gaining situation where your body cannot tolerate this. So the last thing to tell that person is it's actually your fault, but it's actually the information that we've been given. When you and I both had this aha moment, I remember years ago, I studied through the Florida University as a diabetes specialist pharmacist in about 2006. And I'm shocked when I go look at some of the literature that I was given, which really is heartbreaking because that's the same stuff that the patients were told.
Yeah,
And when I spoke life into them and saying, no, 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 hang on, there is another way. It is, you can't just eat as much sugar as you want and think that the drug is going to do it. But there are other ways. That's a very big enlightening thing when you kind of lift that off them going, hang on, you mean I can change? Yes, you can.
yeah. It brings me to a point where I have this patient, let's call him John. Now,
Mhm.
every time he comes in, and this vigilance from me asking him how is his blood sugar doing every time I see him is because he was hospitalized because his blood sugar was too high, and his wife found him on the floor in the living room. So they thought, okay, maybe there's something else wrong, but it was just his blood sugar was really high. So I keep asking him, and he is under strict control by his doctor and the dietitian. I ask him, so what do you eat? Because why I asked him that was when he picked up his prescription, he also wanted me to ring him up for a pack of tortillas. So I asked him, I said, I hope this is not for you. So no, this is for me, but the doctor said I can eat 2 of them with each meal. White flour tortillas. Now, again, that is likely how that dietitian was taught,
Mm-hmm.
and from your literature that you found from your diabetic specialist training, that is how these people are taught. And we know, if you look at the biology, if you already have too much sugar in your blood, does it make sense to feed your body starches where that extra long starch chain is actually a concentrated form of sugar the moment it hits your ileum? It doesn't make sense. So why would you feed somebody extra sugar, even though they'll say, but there's no sugar in the tortilla, but the starches is sugar. So I felt so sorry for him because I told him, I said, you really shouldn't. I said, do your best. He's got a CGM. I said, try this for 1 day, just 1 day. Skip the tortillas and see what your blood sugar does.
Mm-hmm. Mm-hmm.
And he came back and said, you can't believe it. He did not have nearly the blood sugar spike after lunch that he did the day before. So, do the things that make sense. And Yvette, you're the one that always tell our listeners, ask the right questions. Now, if something does not make sense to you, start asking these questions over and over and over again until you get an answer that actually makes sense.
And when you were talking about the tortillas, so both of us live on the west side of America. So Mexican food is a very, very big fan favorite here. People really enjoy it. And we also have a very high incidence of people that have diabetes that love the Mexican food. And I've often spoken to patients and then they'll say, but I'm Mexican. And I'm thinking, well, I'm from Africa. Have you seen how we eat in South Africa? We eat a lot of carbohydrates. We love our protein, but we eat a lot of those. And for people to understand that the food should be your fuel. I'm not saying you're never ever going to eat a tortilla in your life again. No. But at this point, you should not.
Yeah,
And once
absolutely.
you can get past that train of thought, then you can see, okay, hang on, if I'm better, I'm losing weight, that the getting healthy before the losing weight part starts. And then people understand, okay, hang on, if I have tortillas on a Saturday when we have tacos and do that, that's fine. But when we live, what you were saying, 2 of those per meal, I'm sorry. You're setting up that patient for failure. I sometimes wish the person that gives that advice would be sitting with that problem and trying to eat that and see how their results come out.
Absolutely. And
But the CGM that's awesome. That is
yeah.
amazing that they can do that and see for themselves.
Yes. And the thing is also what I feel is to interpret the response of their body to what they ate.
Yep.
Because they can see it firsthand. And CGMs, I think, is one of the best inventions, especially for people with metabolic disorder and diabetes. I think that's just really amazing. But for people to actually see firsthand, if I do this, this happens. If I do this, that happens. So, and see how, because of your blood sugar will still go up if you eat a protein only meal, but not remotely as much as when you throw the carbohydrates in there.
Well, it's interesting that you talk now about the CGMs because a lot of those people are on insulin. And when we were students, the person that was on insulin is the person that were born either with type 1 diabetes or they got an autoimmune disease and developed type 1 diabetes. It was so unlikely for somebody with type 2 diabetes to be using an insulin. But this is now what grows onto our whole story with why did the doctor start me on metformin? Well, this is the first line of defense. If there is no change in diet, metformin also has limited use. There's going to come a point where the blood sugar rises again. And they're like, okay, hang on. we need to put you on insulin now. And when you give some patients that reality that, oh, you mean I'm going to have to use insulin like my mom and my dad? I don't want to do that. So that they understand that there's going to be a time frame. Even if you do take the metformin, if you don't make the changes, you're going to develop to that point. And then what you were saying with the CGM, I find it interesting because a lot of the patients that I deal with the CGM says, how come I'm needing more and more and more insulin? Well,
Mm,
is your blood sugar numbers going up? Yes. It's because you are not controlling what you eat. So then you need more insulin. Same as the one you inject, your body can only tolerate that much, then it needs more, then it needs more. So it's got this tolerance that it builds up. And it's really important for people to know the road they are going to go and make a choice now.
for sure. Because I've heard it said by so many people, especially when we're busy with our functional medicine training. A few of those practitioners said they saw their parents. They said they go to the doctor to where the doctor is supposed to control your diabetes. So you can't control diabetes if you don't go 100% after a lifestyle change and especially a diet change. You can control it with medicine just to a point, and like you say, with metformin, there is a maximum dose where you can't go higher, and your risk of developing all these severe side effects go up with every dose increase. Because 90%, we've spoken of this earlier, 90% of the drug gets excreted unchanged through your kidneys, which means your body does not break it down in a normal usable form. It gets excreted as the actual drug, which causes damage, causes all
Mm-hmm.
these other things that we talked about.
Mm-hmm.
So past that point, if you doctor don't put you on all the other hypoglycemic oral medications, is designed to stimulate your pancreas to make more insulin. That has a limit.
And then if you put all that stress on the kidneys, how many people do we know of that very young end up with dialysis? Because the
Yes, and
kidney can't filter anymore.
and then you can't use metformin anymore because you're not going to get rid of it, and you will get lactic acidosis.
So I know we paint a very bleak picture. And I know you and I both say that, and I agree with that. Of all the lesser of the evils, to start with metformin, not a bad thing. But together with that, you need to start with changing what you eat. Do some research for yourself, like you once said. Get a glucometer, get a CGM, see what the food does. Because eventually down that road, you're going to hit a fork in the road and it's going to be either bad or worse.
Yeah, for sure. I mean, the ultimate when if you don't get your blood sugars under control, there are these very vital organs that we need that gets affected by high blood sugar. The kidneys, the eyes, and the brain. Those are that you can't really get them replaced. You
We don't
can
have
get
spare
it.
parts for those.
Yeah, you can go. Maybe you're lucky and you can get on a kidney transplant list, but that is a terrible life going forward. You might be alive, but you won't have any immune system for the rest of your life because you have to take these immune suppressants lifelong because your body can still reject that kidney at any point.
Now that's a very, very hard life to live. I deal with kidney transplant patients. And if at any moment in time I complain about the smallest things, I've had one that have often said to me, well, at least you don't have to wake up in the middle of the night every night, making sure your blood sugar is fine, making sure your kidney function. And that's really a very big reality check that we can do stuff and prevent that, because that is a part that once you've gone down that road, it is such a hard life.
And I can tell you one thing, if you've had a conversation with one of these people, because I've got somebody like that at my pharmacy too. And every time after we had to have this conversation, and if anybody of our listeners have the same conversation with one of those patients, they will turn around and say, I've got a lot to be thankful for.
Yep, I do that.
Yeah, absolutely. But the thing is, then I also want to say, start appreciating what you have.
Yes. And one of the messages that one of the kidney transplant patients told me, and this is a very young person, and he said if he could speak into the lives of the young people, that he looks around that are obese. He had different problems with that happening. It wasn't the normal route. But if he sees the younger people, he would say, "Please make good choices with your food." And this particular person, funny enough, is one of those that did check the impact of eating more proteins and the fat, much healthier, less infection, things like that really help. But it's a very concern on their heart that some of these younger people are playing with a time bomb, and they really don't care what they're doing and eating and putting into their bodies.
Yeah, absolutely. And I know when you're 18, 19, 20 years old, you think you're going to live forever and nothing is going to
Absolutely
affect you.
invincible. You're never going to have a pain and never going to have an ache. Yeah. And
We've
then life
both
happens.
been there.
Absolutely.
Then what?
So, Johan, the question that we get often, why do I get prescribed metformin? I don't think you and I have a simple answer. It's a mouthful.
Yeah, definitely. There is no simple answer. So if you know somebody who has that question, let them listen to this podcast. Share this with them because sometimes we also just shake our heads. But the thing is, once you get prescribed that metformin, doctor gave you the diagnosis. Like Yvette said, it's not a death sentence. It is really not the end of the world. But the really big hope is that once you get that, the big orange light of the traffic light will show up, which says, warning,
Mm-hmm.
you're at a crossroads.
Wake up.
There's something you should do and do it
Mm-hmm.
sooner rather than later.
And you know what? The younger generation, I'm talking about the children in their 20s and 30s, and some of them that look at their parents. One of the most common conversations I have with them is, I don't want to be going to the doctor every week like my parents do.
Yep,
And
absolutely.
most of the people I'm getting and speaking to with being prescribed metformin new is early teens, early 30s. That's the standard age. Now, we also didn't touch on something there, which is a complete discussion of another day, because a lot of young women get prescribed metformin off label for PCOS. What we can tell you, if you fall in that category, changing your diet will have the exact same benefits that you would do if you were diabetic.
Yeah. And it will
Be-
probably be more effective than
Quicker.
taking metformin.
I have an example of one patient I'm working with, very young, very severe PCOS, wanted to give metformin. And due to the patient's work and lifestyle, she said, I can't do that. And she was willing to do what I said. And you know what? In a space of 3 months, when you get a message from somebody saying, you've given me my life back, I love how I feel and how I look, and I don't have the pain, the discomfort, all of those things, that really makes it worth it. But again, you have to have that frame of mind that change has to come. And if you are going to embrace the change, or are you going to kick against it?
Yes, 100%. And don't think that because you've done the same thing for your entire life up to now, that it is the right thing. We frequently ask the question that how do you know when you're deceived? You don't. So if we tell you that you need to do something different, you can't have 2 tortillas with every meal. It's not that we want to be a Debbie Downer to come rain on your parade. But what you've been told, you probably have been deceived. You were taught and you were told the wrong thing that is going to actually help you and move the needle forward.
Rian, you and I can both admit one thing.
Mhm.
At a point in our life, we were both deceived.
100% and severely so. I mean, we've been doing, living, and preaching things that right now we don't even remotely believe in because we've been deceived. And now we figured out that we've been deceived. And it was a shocking reality because when somebody tells you you have to eat a lot more meat, I mean, I was kind of taken aback. How can you say that? You should not eat so much salads. What? Are you being serious?
Mm-hmm.
Until we went and we did the research to see how our bodies actually work and actually process these nutrients to figure out, I think we have to say sorry for a lot of people because we've been telling them the wrong thing. So if anybody's listening, we were lying to you, I'm sorry.
It's been a long time ago, so I hope
Yes,
not. I hope not. And it comes back to being deceived. Is the saying that we have is, you don't know what you don't know. So once you come across information like this and it makes sense, because this is probably one of the comments I hear the most when I do explain to patients basic biology. This is how it works. This is how we move from point A to point B. And this is the one common answer I always get. Why didn't anybody else explain it so easily to me? Now, I'm not the bright spark. Johan knows all the chemical words and fancy stuff. I just explain it in a nice, very easy way because that's how I understand it. But that's also how most people understand it. So if you can explain it to me in a way that makes sense, I can work with it. But if it doesn't make sense, I'm going to be like, okay, like with the tortillas. So I eat the food, get broken down to glucose. My body needs to store it. So I probably should eat less glucose. But now I'm having 2 tortillas. And I bet you from my years of Weight Watchers and checking those things, they're like 45 grams of carbs per tortilla.
Yes. Yeah, that's a
That's a
lot.
lot.
Mm-hmm.
That's shocking.
Yeah.
Thank goodness I can remember that. And then to me, that is like 1+1 is not 2 here. So that's why we want people to open up their eyes and their ears, start asking the right questions. And if it doesn't make sense, ask more questions, because then the explanation doesn't fit what you were looking for.
Yes, for sure. And I also want to add this in there. If you don't get the answers that make sense to you, drop it in the comments on this podcast.
Mm-hmm.
We would love to see that and see what other questions related to this topic there is, so that we
Yes.
can go, if we don't know the answer, Yvette and me, we will go and we will do the research and bring you the answer.
And, it's very much, this is probably one of the topics that is the heaviest on our hearts, because from this metabolic disease is so many things sprout from that. And the reason we wanted to talk about metformin is because it is so commonly prescribed. So many questions get asked, but there is a multitude of things that fall under this whole umbrella. So if you want more of a specific area going into, yes, we will share more on that. Johan and I are trying to cover the things that we most commonly see in the pharmacy, and it's conversation pieces because we speak about it on a daily basis. And if we get that question every day out of, say, the 40 people I speak to, if I get it twice a day, that means it's a very high possibility that you've asked that question.
Rightfully so. And as we're drawing to a close here, I do want to say, if you're already on metformin, don't just stop your metformin. We are not here to tell you to stop the metformin. You do not stop or change any regimen that you're on without talking to your healthcare professional. But we do want to say there are other things that you can do in order to improve your condition, and do explore that. Ask the right questions and get healthy, because your health is probably one of the best assets you have.
And something you touched on earlier, we won't elaborate on it a lot, but do not accept the fact that the way you feel is because of your age, because of your diabetes. Don't accept those things. Those things can turn around. And with listening to us, what we want you to have is to have the right questions. Because you can ask your healthcare professional this. You can ask the dietitian or whoever you see. You can ask them those questions. And if the answers do not make sense to you or does not give results, that's when you need to seek alternative help.
For sure. Well, Yvette, I think this was very informative. I think we really pounded this topic of metformin and high blood sugar to solidify some ideas in some people's heads.
I think next time you have a patient counseling, you can say, you know what, just go watch my podcast, because
Yes.
it'll explain everything you want on metformin and you can help the next patient, because I know what it's like in retail. So I think this will be beneficial for you, Johan. We use it again.
Yeah, absolutely. No doubt.
It's been awesome. I'm glad we could share this, give people some hope, some advice, just some pointers, and also to understand things a bit better.
Yes, for sure. So take care, everybody. See you on the next one.
Cheerio.
Views and opinions expressed on this podcast are our own and are intended for educational and informational purpose only. This podcast does not provide medical advice, diagnosis, or treatment. The information shared should not be used as a substitute for professional medical advice from your personal health care provider. Always consult your physician, pharmacist, or qualified health professional before making any changes to medications, supplements, or health regimens. We are also promoters of Neolife Nutritional's beauty and household products, and this stems from our knowledge of their purity and the company's reputation to provide products of outstanding quality. While we may discuss our experiences in the retail pharmacy setting and share insights into functional medicine, our conversations reflect our professional perspectives and personal opinions, and not those of our employers, affiliated organizations, or licensing boards. By listening to From Pills to Purpose podcast, you acknowledge that you are responsible for your own health decisions and agree that the host and guests are not liable for any outcomes resulting from the use of the information discussed in this podcast.